And welcome to MedSynapse, where we connect you with leading minds in healthcare. I'm your host, Dr. Nigar, and today we're honored to have Dr. Danjuma Adda, a distinguished Nigerian prince and a prominent figure in global public health. Dr. Danjuma, with a career spanning over 15 years, beyond his role at the World Health Alliance, he spearheads local charity efforts in Nigeria, addressing vital issues such as viral hepatitis, HIV and AIDS prevention and care, patient safety, and antimicrobial resistance. As a senior fellow with ASPEN Institute, a technical advisor to the World Health Organization, and a member of various global networks, Dr. Danjuma is at the forefront of battle against infectious diseases. Today, we dive into the topic of global strategies against viral hepatitis, exploring insights from a remarkable individual who has dedicated his life to making a meaningful impact on public health worldwide. Dr. Danjuma, welcome to MedSynapse.
Thank you, Dr. Nigar, and thank you so much for having me on this program. It is a privilege and an honor for me to be invited to this very wonderful program and giving me the platform to reach out to all your listeners and all the great and wonderful people that are tuning in to listen to this podcast. Thank you for the privilege of being here.
It's an honor to have you here, Doctor, and we're eager to delve into this crucial topic of combating viral hepatitis on a global scale. Dr. Danjuma, to kick things off, could you share with our listeners what initially sparked your passion for advocacy in this field?
What motivated me to start what I'm doing is an incident that happened, two very, and shall I use the word sad or incidents that happened in my life so many years back. The first was in 2004 when during shall I say a laboratory practice, I had this native prick injury and I got infected with hepatitis B, and 2 years after I lost my mother to hepatitis C. And so these two things, the first was when I was diagnosed with hepatitis B through some clinical rotations, and then yet even with my background in virology, I didn't even know much about hepatitis. And then a year after I got married, then my mom passed on from liver complications from hepatitis C. And it was at that point I told myself that whatever would take me to do, I would commit my life. I will commit the rest of my life and my knowledge, my expertise, my resources to increase awareness about hepatitis, to help other people not to experience the pains I experienced when I lost my mom at a very crucial moment of my life. And also, for myself as a person living with hepatitis B, I discovered the lack of awareness even among healthcare professionals, and then the lack of access to testing and the stigma that has associated with hepatitis B. It was a tough battle because it happened at a time I just met the person I was about to marry, and then the challenges of partner disclosure and all those things were issues I had to overcome, and then the mental torture of assuming that you have an infection that could end your life. You may not live to your full potential. You may have liver cancer any moment. So all of these were things that made me first to also invest in learning, and then I started my charity organization in Nigeria to provide access in free testing, free awareness for communities and populations. And through that, my local charity joined the World Hepatitis Alliance. And 2014, I was elected the board member for African region. And then 2 years back, I was appointed as the president of the World Hepatitis Alliance. And all of this started with a passion to change the narrative about hepatitis, to increase awareness, and then to ensure that populations that are left behind have access to care that they need.
Dr. Danjuma, I appreciate your openness about your personal connection to hepatitis. It is undoubtedly a powerful driving force behind your advocacy. Your ability to navigate both the professional and personal aspects of your journey is truly commendable. We're honored to have you as an expert on our discussion today, shedding light on these critical issues surrounding viral hepatitis. Now, let's begin with our podcast. Dr. Danjuma, how does the World Health Organization plan to tackle the problem of low awareness about viral hepatitis and the global health sector strategy? And what can people and communities do to spread awareness?
Well, the first thing we need to understand is that hepatitis is a disease that kills more than 1.1 million people. As at the time when the World Health Organization set up the ambitious goals to eliminate hepatitis, then the mortality from hepatitis was about 1.3, 1.4 million. This is a disease that has one of the highest prevalence. We're looking at a disease that affects over 350 million people all over the world, and then that kills every 30 seconds, one person dies from this disease. So yet, unfortunately, there's very little attention in terms of awareness. So in 2015 and 2016, the World Health Organization set up an ambitious goal to eliminate hepatitis as a disease of global health importance by 2030. Eliminating it simply means to reduce mortality and to reduce new incidents by 2030. And so countries sign up to those ambitious goals to put up policies and programs to ensure that populations are diagnosed, people that have hepatitis are diagnosed, and people have access to care. And then the WHO now reviewed these goals, I think, last year, and there's a midterm target in 2025 to measure progress by countries. So at this moment, it's really unfortunate there are gaps towards elimination. WHO's ambitious goal is to screen 90% of people living with hepatitis B that are undiagnosed and to treat 80% of those that have been diagnosed. At the moment now, for example, in Africa, only 2% of people with hepatitis B have been diagnosed and 0.1% are on treatment. At the global level, it is about 12% for hepatitis C, and then for about a significantly small number for hepatitis C. And that has even been achieved because of one or two countries like Egypt. So while the ambitious goal is towards screening 90% of people with hepatitis, imagine for hepatitis B, we have over 250 million people living with hepatitis B and over 90 million with hepatitis C. So the WHO wants that before 2030, 90% of all people that have not been diagnosed with hepatitis C will be diagnosed, and 80% of these people need to be treated. And that is an ambitious goal that will be able to at least contribute towards elimination of hepatitis by 2030. So what populations and what people need to do is to increase awareness and visibility about hepatitis. Imagine, Dr. Nigar, that hepatitis B, for example, and C are the leading causes of liver cancer, but there's very little awareness about hepatitis. The WHO also has recommended that women attending antenatal are supposed to be tested for hepatitis, HIV, and syphilis, and babies are supposed to receive birth dose vaccine within 24 hours of birth. But it's unfortunate to say that many countries are not rolling out these programs. Babies are still getting infected with hepatitis despite the effective vaccine. So imagine this scenario. There are effective tools that can prevent hepatitis. There are effective tools that can treat hepatitis B. There are effective tools that can cure hepatitis C. But these commodities are not available for populations to access. And that is why it's important that governments and individuals and populations should commit towards raising awareness and ensuring that no one is left behind. People should not lack access to hepatitis because of cost. As a matter of fact, hepatitis care is out of pocket for majority of populations across the world because health insurance is not provided amongst most countries. Most countries don't have costed plans for hepatitis care, and so populations pay out of pocket. Unlike the robust, wonderful treatments and services that are available for other equally important health conditions. So it's important to really say that there's lack of visibility and awareness about hepatitis. We need to increase the awareness. We need more political action and commitment from governments and individuals and philanthropists and donor agencies to invest in stopping this disease that kills one person every 30 seconds. These are not animals. These are human beings. These are fathers, brothers, sisters, children, of people around the world. So we need to stop the needless death of people from hepatitis, because we have the services, we have the tools. But what we lack is the commitment, investment, interest by countries around the world to increase access to care for hepatitis and to ensure that populations are not left behind.
This definitely sounds like a comprehensive approach to raising awareness. It's very important for individuals to take an active role in spreading the information and advocating for hepatitis prevention measures within their communities. Now, talking about the stigma linked to viral hepatitis, what actions or methods are recommended to fight against these negative attitudes and create a better environment for those who are affected?
I think one of the things that fuels hepatitis stigma is lack of awareness, myths and misconceptions, and lack of understanding completely about hepatitis. Up till now, you see a lot of false things. People think that the misinformation out there is that hepatitis is contagious. Hepatitis could be spread through casual contact, and that is why you see in workplaces people with hepatitis are denied jobs. People with hepatitis are denied even visas to go to certain countries, even in Asian countries and some Middle East countries. So the stigma is fueled by lack of understanding. HIV also started that way, but now that is not so much stigmatized like hepatitis. So the stigma is an issue that is limiting access to care by certain populations. It's an issue that is limiting many people from even disclosing their status because people are afraid so that they don't become branded. And it has really limited people aspiring for life ambitions, people seeking for jobs, people traveling or migrating. Stigma has reduced a lot of people from achieving their life potentials. It has stopped relationships, it has stopped marriages, it has even broken down homes because there's a lack of understanding about what hepatitis is. And this needs to stop as we increase more awareness, as we do more to educate communities. We need to reduce stigma and we need to reduce these barriers so that people access the care that they need and people are not denied life ambitions. And let me tell you, Dr. Nigar, it's really traumatic living with a disease that you know can cause you liver cancer. So, the stigma adds to the mental torture, adds to the mental challenges people with lived experience pass through because it's difficult in the home. Imagine a pregnant woman who is knowledgeable about hepatitis is having a mental torture of thinking she might transmit the virus to her baby because of the lack of vaccine. Imagine spouses or couples having those mental, so it affects people's mental health, it affects people's well-being. So, but it's important when there's more awareness, more education, people are more informed, and it goes, of course, to improve access to care around the world.
Definitely, Dr. Danjuma. Creating a supportive environment is crucial for ensuring that everyone receives the care and support they need. Now, with limited funding for viral hepatitis programs, what main points should doctors emphasize on when talking to policymakers to encourage them to allocate more resources to these crucial health initiatives?
What we tell people is that a lot of governments do not prioritize investing in hepatitis because, well, there are a lot of competing needs. There are security threat development, but investing in hepatitis has return on investment. Investing in hepatitis could avert liver cancer deaths. Investing in hepatitis could avert new infections, will improve productivity, will improve daily adjusted life yields of populations, will improve the mental well-being of populations, and ultimately reduce the number of mortality. So what clinicians and people, in fact, one of the things we encourage clinicians to help us do is that clinicians are in a very good position to become advocates and speak to people in government, people that listen to them, and also to motivate patients to become patient advocates as well. A lot of times we encourage clinicians to be active advocates in the space of public health in order to push the narrative and in order to increase awareness and draw and touch the heart and the head of decision makers so that we can improve access to hepatitis care from across the world.
Finally, how can countries work together globally to address the challenge of eliminating viral hepatitis? And what roles do doctors envision for both developed and developing nations in reaching the World Health Organization GHSS 2021 to 2030 goals?
So what countries need to do is to accelerate action. There are many countries that have policies and guidelines, but what countries need to do now is to put money into policies and to programs and operationalize it. We need action. We need political will backed up with action. Appropriating budget, appropriating money for diagnosis, for testing, for treatment, and then reducing bottlenecks for diagnosis of commodities. For example, across most countries, most regional LMICs, there are a lot of bottlenecks before industry, farmers or companies to register commodities. So a lot of times this now trickles down by these companies increasing cost of commodities to patients. So governments could input this into health financing, health insurance, so that patients have access. So ultimately, what we really need is more commitment by either increasing insurance, increasing access to testing, integrating hepatitis, for example, hepatitis B, maternal and child health, into maternal and child health and antenatal, into immunization programs, because the birth dose vaccine is something else that also can improve immunization programs, right? So there's a system strengthening component that hepatitis services can bring about. Healthcare workers are trained. It could be integrated into antenatal care, into maternal child health, into infectious diseases, into cancer. And so it's a win for the government, because I keep telling policymakers that you need a healthy workforce, you need healthy young people. So investing in hepatitis, you avert deaths, you avert mortality, you avert a lot of consequences that may follow with lack of action. In fact, data from Center for Disease Analysis says 1 year delay in hepatitis diagnosis could contribute towards increase 84,000 more cases of liver cancer. So we need to commit more. Governments need to commit resources to ensure that hepatitis care is affordable, accessible, and it doesn't drive people into catastrophic poverty. We need to bring it into universal health coverage so that populations are not left behind, and populations everywhere anytime should access the services. Imagine there's a safe vaccine. So babies should not be born without this vaccination. The WHO recommends that babies are given hepatitis birth dose vaccine within 24 hours of birth. The WHO recommends that women attending antenatal should be screened for HIV, hepatitis B, and syphilis. So, but the case now is that hepatitis women have to pay out of pocket, so this shouldn't be. So we're encouraging governments to put words into action. The guidelines are there, but what is lacking is the commitment to operationalize these guidelines. So we need this to be done. And then for the populations, people should have health-seeking behavior. People should go for testing. People should go for vaccination. And we need to have more diagnosis and treatment for hepatitis in order to reduce mortality ultimately from liver cancer, which hepatitis is one of the major contributors to.
Collaboration between countries is definitely essential for achieving the World Health Organization's goals for viral hepatitis elimination. It's a collective effort that requires commitment and cooperation from all stakeholders. As we wrap up this insightful episode of MedSynapse, I want to extend my heartfelt gratitude to Dr. Danjuma for generously sharing your expertise and knowledge on global strategies against viral hepatitis. Your dedication to public health and your personal journey provided us with invaluable insights for our listeners. Thank you so much, Doctor.
And thank you so much for having me.
Thank you so much once again, Dr. Danjuma, and we're looking forward to many more podcasts together to raise awareness on our MedSynapse platform.
I look forward to that. Thank you.
And to our audience, thank you for tuning in. If you found this episode as enlightening as I did, don't forget to subscribe, like, and stay tuned for more captivating conversations with leading voices in healthcare. Your support fuels our mission to bring you thought-provoking discussions that matter. Until next time, stay connected. Goodbye.